Hi everybody, this is Dr. Leslie Blevins with Enilda Clinic at enildaclinic.com, and today I'm going to do a little overview of what child therapy is, especially during the pandemic where many of us therapists, psychologists, counselors are doing it through telehealth. And I want to do this overview because we've been in quarantine and in the stay-at-home orders for quite a while now, and there's lots of rumors that will be coming out of the stay-at-home orders, but maybe it will be, in staged releases. And so, how long will we actually be staying at home? How what will be the limits of us staying at home or going out into the real world? And so, there's a lot of unpredictability in that. And I want to make sure that parents are aware that there is support out there for your children and for you. And I know just being on Facebook and seeing some of the comments that parents make, it seems that maybe not everybody is aware that we are still providing services. I know here in Washington State that mental health providers are considered essential workers. And so some very few people are still seeing their patients or clients in person as much as we can. I know that the fields of mental health are really trying to maintain social distance so that we can contribute to decreasing or flattening the curve of the coronavirus. And so most of us are still doing telehealth, or we've converted over to telehealth for our continuing patients. And so that's definitely what I'm doing for therapy. For assessment services, so for neuropsychological assessment or regular psychological assessment, I have not been doing that in person because I don't want to do it by telehealth. I know across the country there might be some psychologists who are trying to do it through telehealth, but my personal reasons for that are that most of the tests aren't validated for administration through telehealth. And there is a little bit of research in some cases with very few tests where they've been done that way, but for the number of tests that I give in a typical battery for an assessment, it's just not worth it to do it that way and to feel like the overall evaluation isn't valid. So, and I think most psychologists are doing what I'm doing, where we're just waiting and we'll pick up with evaluations whenever it's safer to do that. Now, of course, if there is a situation where a patient, whether it's a child or an adult, really needs to have the evaluation done due to safety reasons, or for some reason, they're at loss or at risk of losing their home, or getting financial needs, or just safety reasons in general, then I know that every case is individual, and I feel like reaching out to a psychologist in that circumstance is really important, because as much as we can mitigate risk generally, we are also looking to not cause harm by not providing services at all. And so I know I would be willing to see somebody if that need was really clearly present. But that's for assessment. For therapy, I really want to go into telehealth therapy and what I've been learning over the past, I think we're into week 7 now. What I'm really noticing, because I work with children and their parents, is that the children in general seem to be so much more comfortable in themselves through telehealth. They can just act pretty wild at home in their living rooms, and that's nice because I get to see a lot of the behaviors that parents have only been able to describe up until that point. And I love that. And I also get to see a lot more interactions between the identified child I work with and siblings, or just other caregivers, other family members who haven't been a part of therapy up until that point. And so they can fit a whole lot of people inside the living room, and I get to have tons of interactions with everybody and really get to see the true dynamics of what's happening and offer really targeted interventions. And the other thing I would say is that families are really noticing how much easier it is to make a telehealth appointment than to drive across Spokane traffic to get to the office on time. And so that's actually been a big benefit. If you live here in Washington, then you can see me, and then if you live somewhere else across the US, then you can find a therapist in your state who is doing telehealth, and then you can just have therapy from your home, and it doesn't have to be from your living room. I know all of us have seen patients who are just sitting on the edge of their bed or sitting in their car or wherever, just as long as you have a place where you feel like you have the privacy that you can have that open conversation and really get the support that you're looking for, because I don't think that the therapeutic connection has been deterred at all through telehealth. If anything, I feel like it's opened up a lot of dynamics. It's helped patients to feel really comfortable, and it's helped us as the providers to feel like we're able to be there for our patients in this way more stressful time in everyone's life. So the next thing that I wanted to talk about is, if you are a person, a fan of the Enilda Clinic videos that I've been putting out, what is the difference between a learning video and telehealth? Well, the biggest difference is that a learning video is generic information. It's research-based information from my training, my clinical experience. Sometimes it's themes that I've started to pull out across my clinical experience. And so it's never targeted to your family's specific situation. I'm betting that if you've watched a few of the videos, at some point in time you sat there and said, yeah, but I could never do that. And that right there is the difference between a learning video and therapy. In therapy, whenever you're working with a provider, whoever they might be, a psychologist, a therapist, a counselor, whoever, they are trained to target an intervention based on all the different factors that are going on in your life. So, for instance, I work with young children and their families, and if I have a young child client who has a sibling or who has a parent who is particularly anxious about the difficulty going on, then I can create interventions to address all of those different needs, keeping the sibling entertained while we're doing targeted intervention with the identified patient, the young child, or addressing the parent's anxiety about what's happening with the young child, so that that parent can really be present and engaged inside the interventions that we're doing for their child. And so in a way, I'm always doing multiple levels of interventions in order to get the most in-depth targeted effect possible, and I'll never be able to do that through a learning video. Learning videos are really just concepts, and I'm hoping that with a learning video that it gives anybody who's watching the idea that of what psychology is, what behavior management is for children. They're just these researched little tidbits of knowledge that we put together. And my training allows me to kind of do this overall analysis of this unique person and their unique circumstances with these unique caregivers and siblings and teachers and education world all around them, to figure out what sets of interventions will give them the best support ever so that they have the best life ever. And like I said, I went to school for a really long time, and I did not know how to do this before that, even though I probably thought I did, because I was a teacher and I really loved being a teacher too, and so I thought I was really doing it, but I wasn't, I can promise you that. But it took a long time to figure out how to do it, and so I think you can get the basic foundation of what these principles are from the learning videos. But if you really want to know how to implement them for your specific situation, oftentimes it does take therapy. Now that's only if your kid really needs it, or if you figure there's a situation going on in the family, some sort of interaction pattern that you just want to work out. Because therapy isn't always for situations that are dire, where you think it's severe enough, right? I hear a lot of times parents say, oh, I don't think it's that severe. I'm concerned, but I'm not that worried. Things like that. Sometimes that's not what therapy is really always for. I mean, it's definitely for that, but it can also just be to do a little tune-up, just to give you a few extra tools, just so that you feel at your best and your kid feels at your best too. So I hope this little brief overview of just some of the things that have been on my mind that I've been hearing recently about therapy, I hope that it has been helpful for you and you enjoyed it. And I will see you guys next time. You can find more learning videos at enildaclinic.com/learning. Bye guys.